Hello, welcome back to another episode of Ask the Doctor with Dr. Jeffrey Sherman. Hello, Dr. Sherman.
Hello, how are you? Good to see you.
Today, we have a nice show today because we are going to explore Dr. Sherman's vaccine journey. Dr. Sherman has gotten both the first and second dose of the vaccine, and so he'll be able to quell and reassure you that getting the vaccine is definitely the thing you want to do, and it's perfectly safe. The COVID-19 statistics for today are as follows. There's 23.2 million cases of COVID-19 in the United States, and there's 386,000 deaths. We also broke records today in COVID cases because of the post-holiday surge, and this is exactly what health officials have been warning us about, and it's happened. Well, Dr. Sherman?
Broke record for new cases or deaths or both? Is that countrywide or county-wide or everywhere?
It's countrywide.
Countrywide, yeah.
Yeah. Well, that's what health officials have told us, and that's why we're being told to do all the measures that we need to do, like mask wearing, social distancing, hand washing, all that stuff that we've been pummeled to do because it works.
It does work. The mask works. I can't tell you enough. The second I walk out without a mask, I'm like, oh my God, I got to hug. You know, it's pretty much automatic. But in that rare case, I'll forget it. I'm like, oh, geez, I forgot. You got to run back in there and get it. The mask works. I've been wearing a mask every day, all day pretty much. And, you know, knock on the wood, I'm okay. That's the thing. That's what I'm telling you.
Right. Right. And it protects everyone else around you, which protects tons of other people that those people are seeing. And see, it's just an exponential web that's being blocked because people choose to wear masks. But if they don't, then the virus is free to spread willy-nilly. And then we get these situations where we get rises in COVID-19. And it's a pattern that keeps repeating where regions of like counties or even school systems will release restrictions a little bit. And then COVID-19 cases will increase to a point where they have to put them back in again.
Right.
I mean, it's a very observable pattern, and it's basically proved at this point, and yet people still do not understand why they need to do it. But I think we should focus more on your vaccine journey. So yes, you have gotten both vaccines now, and it's only a matter of time before you're immune.
Yeah, it was great. I got the first one back on December 23rd. The second shot was given yesterday around 11 o'clock in the morning. 3 weeks apart. That's the Pfizer vaccine interval. The Moderna is 4 weeks or 28 days. Where I got mine at Cedars-Sinai, they have the deep freezing capability where the Pfizer vaccine needs to be maintained at a low temperature, a very low temperature. The Cedars has those freezers available. Now you remove the vaccine from that low temperature. It's not going to instantly get spoiled. You have about a 5-day window, but they're using them up pretty fast over there. There's a lot still to go. They still have a lot of supply, but my point is, it basically is out of the freezer for an hour, and it's in my arm an hour later, and boom, it's in there.
Nice.
So that was the second dose yesterday. Just like the first time around, a little arm soreness for about 24 hours. It's now gone. The arm soreness started last night, about 8 hours after the vaccine shot was given. It continued into today until around 1 or 2 o'clock. It started to fade. And now it's pretty much all gone as I can move my arm around. And that was the only side effect I had both times with either shot.
That's right. And those are kind of the side effects that you kind of expect with most vaccines.
Yeah, vaccines. I mean, if they don't give you a little arm soreness, you're wondering, did you get it or is it the right thing? And,
right.
You know, is it potent? Is it going to work? If it hits your arm and it feels sore, that means the muscles there are reacting to the substance, to the medicine, and those skeletal muscles, which is why we give it in skeletal muscle, are reacting and flexing and then producing those antibodies right on the spot. as they get exposed to the vaccine. Now it's circulating in the blood, and then it's on there. But skeletal muscle is a very good way of those cells are very effective. So it goes into the deltoid muscle, your shoulder muscle, a pretty thick muscle with not a lot of fat in the area, so it gets going. Other injections go into subcutaneous fat and tissues because they spread better there. These vaccines go into the deltoid muscle, and those antibodies are pretty much churning right away.
That's actually really fascinating. I've never actually heard about why we specifically choose skeletal muscle to put the vaccine in. So that's nice to hear that the skeletal muscle is kind of one of the best and easiest places for antibodies to be developed from a infection.
Yeah, and they work very well.
We have a question from the chat. Does the COVID vaccine hurt more than regular vaccines, or does it feel different in any way?
I can only compare it to the flu shot that I got earlier this year. The flu shot, I felt nothing. This vaccine, especially yesterday, it's cold because of the temperature. You can feel the cold in there. At least I did. It's held at like they hold the vial at minus 80 degrees centigrade, which is below zero.
Whoa.
Even Fahrenheit. It's like 50 degrees below zero. It comes in a powder. They pull the powder out of the deep freeze, and they have cold saline ready to go. They mix about 1.8 milliliters of the saline per vaccine dose. I don't know how many vials, how many doses each vial contains, but they do the math and inject the saline into the little vial of the powder and shake it up and mix it and constitute it. Then they draw it out. So I don't know how many doses per vial they get, probably several. My point is the cold saline and the really cold powder leave, and they bring it right out. I mean, it's not sitting in a holding bin. The nurse is back and forth from the freezer to the table 100 times a day. This guy needs it, so they're bringing it out, and it's ready to go. And that's why it's still cold in there. It's a small needle, so you're not going to feel the needle. You'll feel the burn, if you will, the coldness go into the arm, and it lingers for a little bit. And something's in there compared to your other arm. It's a different sort of feeling, and that's what. And then shortly thereafter is when the soreness kicks in. You can say, yeah, it's starting to feel a little sore, a couple hours. And then by the nighttime, it's definitely sore. And into early this morning was the peak of soreness. And then, like I said, it faded away this afternoon.
Yeah, and that's, of course, a good thing. That means that your muscles are reacting as they should to the quote-unquote invasion of messenger RNA in this case.
Yeah, messenger RNA. Actually, just clarify, I got the Pfizer vaccine, the colder one. The Moderna still has to be stored cold, and it will feel cold as well in you as the same, but it's not as cold, and it doesn't need super freezing. But the hospital's done a good job of keeping these cold. They got plenty of supply. They've expanded the distribution to not only the hospital doctors, nurses, and inpatient hospital people, the nurses, the respiratory therapists, and them, which are all eligible, but healthcare givers in the outpatient setting in the neighborhood, doctors, healthcare workers in their offices, people who deal with one-on-one, direct patient care in the doctor's office, the front office, the back office, those folks. They just need to show documentation that they are employed by a doctor and they get in there.
Wow, so that's cool. It sounds like they're getting through this pretty darn quickly. And they also seem to have enough vaccines to get it through this quickly. Now, do we know when different demographics are going to be getting the vaccine?
No, I think the word now is that anyone, it hasn't, the infrastructure is not quite set up in terms of anyone over 65. That's the next level of vaccinations. And then pretty soon into March, which is about 5.5 or I guess 6 weeks away. That's when, it'll be more available to everybody else at Walgreens, CVS. And we just got to get the stuff out to people. I mean, Walgreens, CVS is a great step, but you got to set up drive-through
Right.
vaccine places, sign up on the county public health, get in line and do it at, when they can vaccinate 500 people an hour or more. You know what I mean? Just
Exactly.
keep it churning.
Right. We have to get through this as quickly as possible. And we also have to make sure that we're doing it safe, because you aren't immune to the virus right after having a vaccine. Although your resistance is increased, you aren't fully immune yet. And so I fear that there's going to be some risk of infections increasing a little bit when vaccines are being rolled out, because people get a false sense of security and end up seeing each other.
They might. We just got to be vigilant in telling folks. There was a study in Israel we brought to my attention today. Thank you very much. That
Right.
you may have seen that, and that leads us to that, where they have a small population in that country. 9,000 people, or 10. I'm sorry, 10 million people
Right.
in Israel. They're vaccinating the elderly folks first. They've maybe gotten through a quarter of their population, and after the first of the two vaccine doses, they're seeing a drop in the vaccinated group, in that age group. The over 65 age group who have been vaccinated their first shot, they're seeing the COVID cases fall in those guys. So there is there is some help with that first dose, and that second dose is going to give it even more immunity and longevity of that immunity. To hopefully at least a year.
That's right. And this is all very good news. The vaccine appears to be working as planned, and we hope that the virus can get wiped out by this vaccine effort so that we don't have to worry about it ever again.
Yeah.
Like various other diseases in the past, like polio and smallpox. Those are diseases that we don't really worry about anymore.
Yeah.
Because of vaccines.
At first, there was some trepidation about those vaccines too, but this time is, on a mass scale, we will see how effective and safe this one is, and folks have to see the science and believe the science. You can't just, come across 2 + 2 = 4 and say, I don't know if that's true. No, that's what it is, and let's get everybody vaccinated. And you're going to have an allergic reaction within the first 20 minutes. All these centers are holding you after the vaccine for those observation period to make sure you're fine. And then the rest, if you're going to have an allergic reaction, is within, a severe one is within the next 8 hours. So you're not too far away from any help.
Exactly.
There could be a delayed little mini reaction, which is expected. A little fever, a little chills, a little fatigue. You take you go to sleep, you take a little Tylenol, you wake up the next day, you're fine. That's more typical of what side effects are going to be.
Right. And of course, if you do have an allergic reaction, like you just said, it's going to happen so soon that you're probably going to be still at the hospital when it happens. And so you should be able to get help right away. And in fact, don't they actually walk?
I don't think they had a crash cart there. Maybe they did. That's a little bit overkill if they do it. They have epinephrine. They got prednisone. They got the ready for the equipment for anybody who may adversely respond. So, yeah, you're right there. And, I've heard maybe 6 to 10 folks have had an allergic reaction out of millions so far. Or, I mean, it's
nothing to worry about.
Yeah, it's ready to go. The COVID is a bad thing to get. I'd rather have a allergic reaction for 10 minutes than COVID for 2 weeks and be in the ICU, and who knows how it will affect any one of us. So
exactly,
you can't be cavalier.
That's something to emphasize too, is that especially for allergic reactions, we know how to deal with allergic reactions by now. We've dealt with allergic reactions for many, many decades already, and so we know how to treat them. The COVID-19 virus, although we're learning how to treat it, we just don't know everything there is to know about how it affects our bodies. And so it's much safer to just get the vaccine, deal with everything that we know, if you get anything at all with that vaccine, than to get the unknown COVID-19 virus and potentially get lifelong detriments to your health. Like COVID-19 lungs, after having a severe case of COVID-19, those lungs look as bad or worse than smokers' lungs. We've always heard about smoking as being very dangerous to your lungs. Well, COVID-19 is actually more damaging to your lungs than smoking over a lifetime. And you're going to have those scarred tissue
for a lifetime. What's going to happen? You got the young people who get it or whatever, and they bounce back and they're okay. But yeah, you don't know what your lungs if a 20-year-old gets it now and in 30 years they're 50 and they catch pneumonia. I mean, who knows what's going to happen for that pneumonia, since they had COVID, scarring in their lungs, for example, or something like that. And so it may be a more difficult case. Who knows what it's going to be down the road? Is this a pre-existing condition for health insurance, or do you got to put it on your life insurance, past medical history, and then your life insurance premiums are through the roof, or things like that? And these are things to think about. So the vaccine will head that off at the pass, and be a game changer.
Right. We have a good question from the chat. How long does the COVID vaccine last for? Do I have to take it again in 1 year?
That's the study is still ongoing. We got the study approved by the FDA because the endpoint was what's the COVID infection rate versus the vaccinated versus the control group, and there was a 90% or a 9 times more effective way of being that was measured. That was the endpoint of the study. The endpoint meaning the data was wrapped up in a little bow and presented to the FDA. Those same patients, however, now are continuing on, right? So from the point of their enrollment in the study 6 months ago, all throughout the last year and into this year now, they're checking their antibodies. So in a few months, we're going to see the next study with the same basic patients with a different endpoint this time, saying how long does the antibodies last, and we'll see. And if they start to die off after a certain number of months, then you'll need another booster or something like that. But the thinking is, if it's similar to the other coronaviruses in the family, the flu and so on, that it would be probably a yearly thing. But the data is still being developed, and we're waiting to see from that. I got an interesting bit of information. So when you're testing for antibodies, like these patients are doing, it's a different antibody test for the vaccinated patients versus the naturally infected patients. So you got to run if you run the natural infection antibody test against a vaccinated patient, it's going to come up empty. So there's that distinction there. There's different kinds of antibodies being produced. That's why patients with post-infection still are candidates for a vaccine.
Okay. That's good to know. So even if you have COVID-19 in the past, or even if you probably have it now, you should still get a vaccine because it will just protect you in the future.
Yeah, and it's a more robust immunity. The antibodies are like 9 or 10-fold of a naturally infected patient.
And I imagine that since we're testing people in trials about how long the antibodies last in the body, because we're testing them and we started testing them a while before we're rolling out vaccines, we're going to know ahead of time. We should know ahead of time if a vaccine has to be yearly, and so we can prepare for it accordingly.
Right.
Now, another thing to consider.
Levels change. You want to just see a sustained level of vaccine. It doesn't have to keep going up necessarily. You just need it to not go down, and it's a sustained level over time. But yeah, we will know, as hopefully most people are getting vaccinated by the end of spring, early summer. We'll know how long the original, the vaccines last, and the folks who were vaccinated in the winter, if they need their booster in the upcoming winter, they'll be able to get those, and the process will continue.
Right. And of course, the end goal of basically all vaccines is to make it so that a disease is eradicated and we don't have to take the vaccine anymore.
You want to make it so there's no population to host the vaccine. You can either get the vaccine to host the virus. You can either get the vaccine, and then the virus enters your body and it's toast. It can't go anywhere. It's not going to get very far. Or naturally immune patients won't get it. So the vaccine then will just run out of people to find to infect. That's the whole point. And then the numbers will go down to where it's negligible. Viruses mutate a little bit, but so far it looks like the current vaccines are, whatever mutations we've seen, these vaccines are still effective. Thank God.
And what's very important too is that because we've eradicated smallpox in the past, right, and we don't have to get the vaccine anymore, we have to try to replicate that this time by attempting to eradicate COVID-19 with this vaccine, which makes it even more important that everybody gets it, because then future generations won't have to get it, and that'll just be a save on resources. And you see, infectious diseases need hosts to keep surviving. And so if you vaccinate all the potential hosts, then the infectious disease won't have anywhere to live, and then it will die out. And that's the goal here, and that's why we urge everybody to get a vaccine.
The virus will die out in patient A, but patients, the patient A can't give it to B, C, D, E, and F because they've been vaccinated. And then pretty soon, hopefully around 75 to 80% of the people who have been vaccinated, that leaves the virus to bounce around the remaining 20%. Let it bounce around them, and then they'll be immune. And then what? Right? Then where does it go? So that's what we're looking for.
Exactly. And nothing to keep.
Have people who aren't going to get the vaccine, and with and they'll eventually get it. The vaccine will find them. But once the vaccine hits once the virus has hit everybody, and it just doesn't have anywhere else to go, then it's toast.
Right. And one thing to keep in mind too is that if anyone is out there is truly concerned about the safety of these vaccines, one thing that you can look at is if everybody gets the vaccine and the disease is eradicated, then future generations won't have to get the vaccine. So if you have any frankly unbased thoughts or concerns about the vaccine being dangerous to your health, you can at least consider that if you don't want future generations to have to take the vaccine, then if you take the vaccine yourself, then that will help towards future generations not taking it as well.
Yeah, if nothing exists anymore, you don't have to protect yourself from something that's not out there. Smallpox, there's no more vaccine. Unless some crazy Wuhan guy starts to invent it again.
Invent it again. Oh, that would be a disaster. Well, wait. We actually have smallpox samples in these very, very bunkered, isolated places, specifically in case it comes back and we have samples to make vaccines. So even in that case, we should be fine.
Yeah. But we can't, the vaccine, you got to get the immunity up to 80%, and you got the patients willing to do it, or the folks willing to do it. Let's have the infrastructure to deliver it, Yes. Bring the vaccine to the people. Set up mass, like in the park, or they're setting one up in Dodger Stadium. You drive through all these cones, you get a shot, you pull over to the observation spot, you're good, you drive away. It's totally doable. Just bring it to the people. Make it easy for the people to get there.
Right.
Drive up, walk up, none of this appointment in 6 weeks stuff. Let's just get it done.
Exactly. All right. Well, I think that's a good place to slow down and end off the show for today. Was there anything else that you really wanted to bring up today, Dr. Sherman?
No, but I'm just saying my message has always been the science doesn't lie. The numbers are good. Efficacy, safety. and I can speak from experience now with both shots in the right arm, my dominant arm. So I use my dominant arm. I was on the Stairmaster yesterday doing this kind of thing to really get it going. Just
Right.
believe the science, believe the facts, and don't wait for things to come to you. Go out and get
Exactly.
it.
Right. We need these vaccines to get to as many people as quickly as possible, because then that will prevent people dying every day.
Yeah.
People are dying and suffering every day from this disease. And so the sooner we can get these vaccines out, the sooner we can stop that.
Yeah, and you want to hug your grandparents. You want to hug people again. You want to interact again. I mean, it's been
Exactly.
rough. Some people like it this way, and that's fine, but the rest of us don't. We want to
Yeah.
get out there and, we want to attend a ball game. We want to get out and go to the park and hang out. We want to go to dinners and restaurants and concerts and everything. Let's do that again.
All right. Well, if you happen to be in the Los Angeles area and you want to see Dr. Sherman, his office email is in the chat, as well as the office phone number. That phone number is 310-659-9600.
Yeah.
If you have any questions that we couldn't get to live during the show, you can email us at myworldsciencetv@gmail.com. We do these every week. And until next week, stay safe.